Looking to get things going with your labor? Well, you've come to the right place. Today I'm going to be talking all things natural labor induction. I'm also going to be showing you some acupressure points that you can stimulate yourself at home. Hello and welcome. I'm Michelle Kapler, your women's health coach. Here on my channel, Well Women Care, I discuss all aspects of women's health and hormones and how we can support the health of those hormones with food and other natural medicines. If that sounds good to you, be sure to hit that subscribe button below. You might not know this about me, but I'm a registered acupuncturist, and I've been exclusively practicing in the area of women's health for my entire 10 years of clinical practice. I'm also a fellow of the American Board of Oriental Reproductive Medicine, which is the governing body for reproductive specialists in the United States. And I've performed hundreds of labor prep and induction treatments in my clinical practice. Today, I'm going to be talking about natural techniques to prepare for and induce labor, including some acupressure techniques that you can do at home. I also want to jump in with a little disclaimer here. This video is meant for informational purposes only. This is not meant to diagnose or provide you with a treatment plan. Of course, you want to consult with your midwife or healthcare provider or doctor before you start any course of treatment at all, including something like this, but most providers out there are willing to give the okay to do something like this. So first, I want to talk a little bit about how labor induction acupuncture works in the first place. In clinical practice, when we're providing acupuncture to a person at the end of their pregnancy, there's a couple of objectives that we're looking to meet during that treatment. So our first objective is cervical ripening. And with that objective, we're just looking to prepare and encourage the cervix to get ready for labor, so dilate, thin, and open a little bit. The second objective with our treatment is that we're looking to relieve any discomfort that the person might be having. So that could be back pain, pelvic pain, hip pain, any kind of physical pain, but we're also looking at treating things like constipation, hemorrhoids, digestive issues, acid reflux, headaches, depression, insomnia, anything that you might inevitably experience at the end of your pregnancy. And the third objective is that we're just looking to calm the nervous system, which is a really important part, especially during times like this. These types of labor preparation treatments typically begin at 36 weeks of pregnancy and continue until the due date. When we reach the due date, or if there is a medical reason to look at it sooner, we can transition our treatment objectives to actually inducing labor, meaning that we're actually looking to make the uterus contract using our treatment. Now, I want to take a quick moment to talk about labor itself and the onset of labor. And I think it's really important to recognize that labor actually begins from the baby. It's the baby that begins that cascade of hormones that make labor happen. And so in reality, no amount of acupressure, acupuncture, bouncing in a ball, walking on uneven surfaces, sex, nipple stimulation, or hanging upside down or eating pineapple cores is going to make labor come on in a sustainable and effective way unless the baby's actually ready to come. If you want that to happen, you're really looking at a medical induction using pharmaceuticals or other medical techniques. But there's definitely things you can do. We're using these treatments to help to encourage the cervix to ripen and get closer and more ready for labor. When folks come into the clinic who are actually past their due date and are looking for an induction, we often do things like hooking up the electrostim machine to their lower back to get the contractions going in their uterus, because there's muscles that wrap around from the back all the way to the front. And so we can use techniques like that. Obviously, at a time like this, when you're not able to get clinical care from allied health professionals, you have to be a little bit more inventive. And so that's what I'm here today to tell you about, is a couple of points that you can use to self-stimulate at home. Obviously, it's not going to be a replacement for actual acupuncture, but I do believe that you can get at least some benefit from treatment by doing these at-home stimulations. So today I want to show you the three main points that most practitioners will use to induce labor or to do cervical ripening treatments. They're kind of the three main points that are regarded in Chinese medicine as the forbidden points in pregnancy, and they are points that you wouldn't do at any other time in the pregnancy because they are known to produce uterine contractions in some individuals. So our first up is large intestine 4. So to locate this one, you're going to be looking at the back of your hand. On the back of your hand, you're going to be going between the first finger and the thumb in this little fleshy bit of material here. So you're looking to land pretty much right in the middle of the bump, but what you want to do is you want to take your finger and hunt around a little bit in the area. Now you're going to be using pressure that's pretty firm, and you want to just poke around a little bit and you'll find that there is a place in there that's especially achy. And so you're going to be looking for that spot that's extra tender right in there. So Li4 is approximately there, but everybody's body is different, and so you'll want to just explore for yourself where you might be able to find that point on your own hand. Next up, we have gallbladder 21, and I'm going to be demonstrating this by turning around. So what you want to do is you want to find the base here, and you're just going to follow the spine down, and you're going to come up against one of the vertebrae that sticks out more than the others. So you'll come down and you'll find it right here. And so that's your first landmark. Your second landmark is to go here on the shoulder, and you're going to find the most bony protuberance right about there, but if you run your finger along, you'll find it. And you're going to be going approximately half. Again, every individual is different, so you're going to want to feel around in the area, try a couple of different spots, and you're going to want to find the most tender for you. And so if you inch along here, you're going to know when you hit it. You're going to want to use quite a bit of pressure to find this point, but you'll know when you've hit it. It kind of produces this deep, achy sensation, and you'll definitely know when you get there. So this point on me is about there. The next point I'm going to be showing you is on the leg, so I'm just going to stand up to show you that. So here on the leg, there is the ankle bone right there, and you're looking at the inside of the leg as opposed to the outside of the leg, because there are two bony protuberances on the leg, so you're actually looking on the inside. And to landmark this point, you're going to be using the entire width of your knuckles. So from the outside of the pinky all the way to the first finger here. You're going to take your set of fingers and you're going to place it right in the middle of that bony spot on the inside of your leg, and you're going to come the width of your knuckles. So it's approximately there. What I recommend doing is starting at the bone and just running up the middle of the leg like this, and you'll find that you actually fall into a bit of a divot when you find the point. And again, you can use that test where you really massage along the point, and you'll know when you've hit it because it's quite tender. So next I'm going to talk a little bit about how to actually stimulate the points. So I'm going to be using the Li4 point as an example, but all of the points can be stimulated in a similar way. So the frequency of massage, you're going to look to do this about 3 to 5 times a day. When we're doing acupuncture treatments in the clinic, we're going to be leaving the needles in to stimulate the points anywhere from 20 to 30 minutes, depending on your comfort. Often when you're really, really pregnant, you're not going to be able to lay on the table for an especially long time, so those treatments can be a little bit shorter. For some, they really find them relaxing and want to stay longer on the table. It's just dependent on the person. But for at-home purposes, you want to get about the equivalent of 20 minutes of stimulation. And so you can do it, in 3 parts throughout the day and do 10 minutes each, or you can look to do a series of shorter treatments, maybe 5 minutes each, and then space them out a little bit more frequently. But again, you're looking to get about the same amount of stimulation, so approximately 20 minutes. And so when you're looking to stimulate the points, you're going to landmark and find your point here. So again, I'm going to use Li4, large intestine 4, as our example here. And the pressure that you want to use when stimulating an acupuncture point is actually quite a lot. So you want to do it pretty much as hard as you can stand it. I often suggest to people when they're wanting to stimulate these points for labor induction that they have somebody else do the massage for them, because other people are probably going to be able to give you a little bit more pressure than you would give yourself. However, if you don't have access to a partner, it's totally fine to do it yourself as well. So you're just going to find the point and you're just going to give it a circular kind of massage like this in the area. And again, you want to do it almost harder than you can stand. And so you're going to do it on both sides. So if you're doing 10 minutes of stimulation at one time, you might do 5 minutes on one side, 5 minutes on the other side, and then repeat with the other points throughout your body. So again, GB gallbladder 21 and spleen 6 on your leg. There are a couple of other things that I'll touch on as well. There are 1,000,001 different things that people on Facebook and different mom chat groups and parent chat groups will tell you that are effective for labor induction. there's always somebody that swears by whatever they used, and 2 hours later they went into labor. Some of these things actually have been researched, some of them haven't. So the first one that I would mention is the release of oxytocin. Oxytocin is something that does participate in that cascade of hormones that help to initiate as well as progress labor. And oxytocin is kind of that feel-good, lovey chemical that gets released in your body. And so there are a bunch of ways that you can actually initiate and accomplish this. And most of them are just doing things that feel nice. So things like cuddling with your partner, cuddling with your animal, cuddling with your other kids. Other things that have been shown to release oxytocin, things like nipple stimulation, and also having sex with orgasm has been shown to produce the oxytocin release as well. Another thing that's been shown in research to be effective is the use of semen. So if semen is something that's available to you, you can apply it directly to the cervix. And by apply it directly to the cervix, I mean most people have sex with ejaculation. Semen contains something called prostaglandins, which are naturally occurring, and it's chemically similar to what they would use in the prostaglandin gel in the hospital to induce, ripen, and open the cervix. So you can use semen to accomplish this as well. The other thing you can try is walking on uneven surfaces. And now I don't recommend doing this without a partner or a support person, but walking up and down stairs or 1 foot on the ground, 1 foot up on the sidewalk can be really helpful if you feel like you have the energy for that. But again, there are things that are less involved with using energy that might be more helpful to you. I also want to take a moment to touch on red raspberry leaf. It's something that's commonly referred to out there in the world as something that can be used as a tool to induce labor. But red raspberry leaf actually is not, in fact, a herb that will induce contractions. It's something called a uterine tonic, which means that it serves to strengthen the uterus, and so it makes the muscle of the uterus stronger so it can produce more effective contractions when you do go into labor, but it's not something that creates contractions. There are herbs out there that do create contractions, and they're known as abortifacients, but raspberry leaf is not, in fact, one of them. So that's why I encourage my patients all throughout their pregnancies to consume red raspberry leaf, because it will not create those uterine contractions. So if you're drinking 10 gallons of red raspberry leaf a day, your uterus is going to be super strong and ready for labor, but it's not actually going to bring on that labor itself. So there you have it, a couple of acupressure points that you can do at home. Obviously, if you have any questions, you want to consult with your midwife or doctor first, but these points are usually considered safe for most people, especially if you're not actually using acupuncture needles and you're just doing self-massage at home. But if you're curious at all, definitely talk with your doctor. If you want to stay connected with me, or if you have any questions at all, I'm going to be posting the link below to my clinic here in Toronto, the Toronto Reproductive Acupuncture Clinic. You can reach out anytime throughout the website, or you can connect with me on Instagram, Michelle Kapler Wellness, and I'm looking forward to seeing you in the next video. Thanks so much for watching.